my name is Dr. Monty, and I'm going to discuss neurohumor called warm and loving. Warm and loving is our name for a neuropeptide hormone made in the hypothalamus during everyday life. It is released directly into the blood from the pituitary gland. It can make you feel that other people like you and that you feel good towards them. It creates an affection bonding, warm, loving feeling that you love to feel. It is one basis for loving and affectionate sexual encounters, increasing the responsiveness of the lady and enhancing the potency of the male. We call this hormone warm and loving because that is how it makes you feel when you respond to it clinically. In sensitive patients, it makes you feel like bonding in closeness and in a warm interpersonal relationship. Warm and loving is released in response to a variety of stimuli, including skin-to-skin touching, kissing on the lips, and on erogenous zones like the neck, ear, and genitals. A man responds to a fetish, like seeing sexy underwear on a beautiful model, with real interest in the excretion of some warm and loving from his hypothalamus. He becomes talkative, charming, and expansive when he is turned on by the sight of an erotic object. This turn-on is likely related to an increase in the level of warm and loving, which occurs in response to the sight of his fetish. People with Raynaud's syndrome, or extremely cold, freezing and bluish fingers and toes, experience warmth in their cold fingers and toes when they take an active dose of warm and loving. Because warm and loving is a neuropeptide hormone, it is broken into little pieces and can't pass through the acid that you have in your stomach. So it's necessary to place warm and loving lozenges called a troche underneath your tongue. And then it gets absorbed through the blood vessels sublingual. Liquid form is available in drops, and you put these drops under the tongue and hold them there for as long as possible, perhaps a minute or two. The usual dose of warm and loving is about 20 to 40 milligrams. So oral under the tongue drops come in 15 milliliter bottles, contain 10 units per milliliter. So 1 or 2 milliliters are taken under the tongue for a dose of 10 to 20 units. There are troches to take containing 20 to 40 units for under the tongue application. The proper dose for you is determined in an office visit with me, Dr. Monty Meldman, doing business now as Dr. Happiness at 224-250-0179, located at 420 Lake Cook Road in Deerfield, Illinois, 60015. Yes, Dr. Happiness is a name for doing business as Dr. Happiness. But as long as we are talking happy tabs, wouldn't you like to visit a Dr. Happiness?